More now on former President Biden's prostate cancer diagnosis. Joining us now is Dr. Sean Sachdev, a radiation oncologist from Northwestern Medicine. Thank you for being with us. Let's start with the diagnosis itself, treatment and expectations. It's being described as aggressive and has spread to his bones. So what can patients like him expect?
Well, thank you for having me. I was saddened to hear the news that President Biden was given this diagnosis. However, through advancements in science, research, and clinical trials, we have learned quite a bit over the years as to how to more effectively treat such a cancer. And we're fortunately seeing that outcomes are improving by the year, and people do far better than they did 5 or 10 years ago. What we know about President Biden's cancer is that it is spread to bones, which is typically how prostate cancer spreads throughout the body. And under the microscope, it seems to be a bit more on the aggressive side based on his Gleason score. The Gleason score is a number that we as prostate cancer doctors ascribe to a new diagnosis to try to predict how quickly prostate cancer cells can divide. That number goes from 6 to 10, and he was at 9. Now, of course, that sounds bad, but there are very effective treatments. Typically, in a case like his, the patient is started on hormonal therapy, which is a medication that limits the amount of testosterone production in the body. And we do that because testosterone is like food for prostate cancer cells. And we take much of it away, prostate cancer cells can't thrive, they can't grow. We can dramatically slow the prostate cancer down and cause it to shrink. Additionally, we have modern drugs that can block the pathways that prostate cancers need to thrive. And even with that combination alone, hormonal therapy plus one of these drugs, we can expect a patient to do oftentimes very well for years.
Okay.
Rarely, if it's more intense than that, we need more advanced medical therapy. And if it's more limited, if it's only if it's only gone to a few sites in the bone, then we can also consider very aggressive focal treatment like radiation treatment to the prostate gland and to the sites of the bone, and oftentimes put the cancer away for good.
So, doctor, prostate cancer is not uncommon in older men. We've heard a lot about the ease of screenings for years. Do you expect this was, identified a while back and perhaps because of his age, just being monitored until they saw this type of growth?
That is a very, very good question. And I think a lot of us are wondering, what those details are. We would love to find out, how quickly or if at all the president entered his screening program. Now, of course, as you know, oftentimes the best treatment is prevention. And it was unclear if President Biden was getting annual prostate cancer screenings. National guidelines recommend strong consideration as a discussion between a man and his primary care physician or his internist of PSA screening, which is a blood test for men who are in their 50s and possibly earlier if they have a higher risk of family history. And unfortunately, it's unclear if and how he was being screened, if at all.
The former president's 82 years old. Does that factor into his treatment? His age?
That is a very, and that is a very important question that we think about all the time. Now, while we don't have full details of his prostate cancer diagnosis, based on what we do know, a new prostate cancer diagnosis like his can oftentimes mean that many men will go on and do well for years. And many men will go on to live 5 plus, and if the disease is limited and if there's a good response, for 10 plus years. Gotcha. Which frankly, in his age group at 82, this may be the kind of diagnosis that he just lives with. He carries a diagnosis of prostate cancer, but it may not interfere with what he's able to do. Gotcha. And it may not make a big impact in his outcomes over the next few years.
Dr. Sean Sachdev from Northwestern Medicine, we appreciate your insight. Thank you so much for joining us.
Thank you for having me on.
Lourdes?